morning. My topic is very extensive, as you all know. Psychotropic agents and their impact on cognitive functions. When I searched the literature, I used different groups to scan the PubMed, which included antipsychotics, antidepressives, anxiolytics, mood stabilizers, and psychostimulants. As you can see from the outline of my presentation, I will go one by one and I will try to summarize all the information that I could get together. Of course, it's known that antipsychotics have a great impact on cognitive functions, and there are many studies on this issue. As you know, in schizophrenia, cognitive functions, attentions, working memory, and episodic memory are affected, and significant cognitive impairment is identified. In psychotic patients, the prevalence of hallucination and delusions varies between 20 to 40%, whereas cognitive functions are affected by 85% of our patients. And one of the best predictors of cognitive skills are these impairments that occur especially in schizophrenia. Dr. Özcan just described it very well. In the pathophysiology of schizophrenia, many different neurotransmitters play a role. According to the dopamine hypothesis, cortical dopamine is decreased, which is also associated with the impairment in cognitive functions, and with the positive signs are associated with increased subcortical and limbic dopamine levels. In psychotic inpatients were given in a randomized fashion risperidone and olanzapine, and they were evaluated in a study. These are psychotic patients, and they were compared to healthy individuals. At the baseline and on the 6th and 16th week, various neurocognitive tests were conducted on the patients, and improvement in cognitive functions as well as demographic functions. And these drugs have been shown, independent from the drug doses and demographic functions, they have been shown to improve the cognitive functions. There are other studies performed on quetiapine. In schizophrenia patients, quetiapine has been shown to improve cognitive functions better than haloperidol, olanzapine, and risperidone. Another study comes from Turkey, and quetiapine has been shown to have a positive effect on motor and certain cognitive function tests. We have another preliminary study that was conducted on only 9 patients, because this is a pilot study. The number of patients is usually limited. Quetiapine at a dose between 900 and 1200 mg were given to these patients, and then the patients were evaluated based on a social cognitive functions, and it was shown that the cognitive functions improved compared to the baseline levels. Another study was conducted to measure the impact of risperidone and quetiapine on cognitive performance in schizophrenia patients, especially quetiapine and risperidone, because of intrinsic side effects. And you know, the anticholinergic side effects of these drugs in schizophrenia lead to cognitive impairment. And quetiapine and risperidone, because of intrinsic anticholinergic side effects, may lead to complications, and therefore you should be very careful when you prescribe these agents to your schizophrenia patients. Another study was conducted on olanzapine. It was published in the Clinical Psychopharmacology Bulletin. It was conducted by Iqbal Chili Inamne and his co-workers. 26 schizophrenia patients were compared with 19 healthy control population. Many different tests to measure the cognitive functions were given. Olanzapine dose was between 5 to 30 milligrams per day and was given for a duration of 8 weeks. And it was shown that olanzapine has a positive effect especially on the working functions, attention and memory functions in schizophrenia patients. In cognitive functions, the D1 receptors in the prefrontal area play a role, and a decrease in number of D1 receptors has been shown to be associated with an impairment in working cognitive functions. And olanzapine is suggested to have a direct effect on cognitive function. This hypothesis was put forward by Weiser and his co-workers. There are certain comparative studies, especially the first and second generation antipsychotics were compared. The typical and the atypical were compared in some of these studies. For example, a randomized double-blind selected schizophrenia patients received olanzapine, risperidone, quetiapine, ziprasidone or perfenazine for 16 months. At the end of 2 months, it was shown that in all the groups the neurocognitive functions improved, and at the 18th month, perfenazine has been shown to have a better effect. It's quite interesting. Another study conducted by Goldberg and his co-workers, second generation antipsychotics were compared to low dose first generation antipsychotics, and although the first generations are not as effective as second generation antipsychotics, they still have a positive impact on cognitive functions. In Turkey, another study was conducted with 25 patients on antipsychotics and 38 patients on atypical antipsychotics were compared. And in both of the groups, these drugs have been shown to have positive effects on cognitive functions. Especially the new generation antipsychotics have a better impact on attention and cognitive functions compared to classical neuroleptics. The positive effect of atypical antipsychotics, how do we explain the mode of actions? As you know, together with clozapine, atypical antipsychotics have been shown to have a more positive effect on cognitive functions. Atypical antipsychotics have a different receptor profile compared to the typical antipsychotics, which leads to less side effects and to an increased effectiveness. Especially because of 5-HT2A receptor antagonism, it increases cortical dopamine transmission, and with the increase in the prefrontal cortex dopamine, there is an improvement in the cognitive functions. This is the hypothesis. In addition, many different treatment strategies have been adapted in the literature. By increasing the cholinergic activity in the muscarinic and nicotinic receptors, certain cognitive functions may improve in schizophrenia, and then the investigators have compared the addition of cholinergic agents to atypical antipsychotics, and in this context, for example, 5 to 10 milligrams donepezil was added on risperidone and compared with placebo. However, in this study, no significant difference could be identified between placebo and the study population. On the contrary, when donepezil was added on olanzapine, and the results show that there is an improvement in verbal and visual memory. Because it was shown that 5-HT1A agonists increase cortical acetylcholine, the addition of antipsychotics may improve certain cognitive impairments in schizophrenia patients. There is a study conducted by Sumiyoshi and his co-workers. 11 schizophrenia patients received tandospirone, which is a 5-HT1A study. This is an open-ended study, and it was shown that the verbal memory improved in this patient population. Another study conducted by the same group, buspirone was added on the antipsychotic treatment, and at the end of the study there was a significant improvement in the long-term memory and verbal fluency. The cognitive impairment in schizophrenia is also associated with a deficit in nicotinic receptors in the brain. As you know, nicotine has an effect on the nicotinic receptor subtypes and induces the secretion of various neurotransmitters. Especially new generation antipsychotics have certain effects on these receptors. In the treatment of cognitive impairment, new nicotinic agonists and antipsychotic treatments are combined, which gives us some hopes for the management of schizophrenia patients. Again, the use of combined antipsychotics is recommended, especially in the management of cognitive impairment in the context of schizophrenia, as it is known, because atypical antipsychotics have an effect on different cognitive areas. Maybe we will have a better outcome if we combine different types of antipsychotics. However, the results of the studies are contradictory. With the increasing number of drugs that are used on the patients, the anticholinergic side effects are increased, which may have a negative outcome on the patient treatment. As you know, cognitive functions and negative symptoms, the improvement in them is lower compared to the positive symptoms, because antipsychotics have an effect on the specific working functions, although the data is limited because of their effects on muscarinic, glutamatergic, and cholinergic system. Atypical antipsychotics appear to be more beneficial compared to the typical antipsychotics. Again, cognitive improvement that is associated with antipsychotic drug application may be the result of an improvement in general cortical information processing process. And in a study conducted by Goldberg and his co-workers, it was shown that specific genetic polymorphism may be interacting with antipsychotic treatment, especially cortical O-methyltransferase well 108-158 MET polymorphism has been shown to be a predictor in the improvement of memory in schizophrenia patients who are on antipsychotic treatment. To improve the cognitive functions in schizophrenia patients, also antidepressant addition was tested. This is a study conducted by Friedman to 16 schizophrenia patients, Stalopram 40 mg per day for 24 weeks, when it is administered in a randomized placebo fashion, and the measurements were compared on the 12th week, and it was shown, and no difference between placebo was shown on its effect on cognitive performance. As a result, it was suggested that atypical psychotics pharmacological profile and its effectiveness on serotonergic receptors has a negative impact on Stalopram effect. There is a review on the addition of antidepressant to antipsychotics. 6 studies were reviewed. In 2 of them, modafinil has been shown to improve the short-term memory and attention. In 2 imaging studies, and no association between working memory functions was identified. Therefore, all the areas need to be evaluated separately. As it is true for schizophrenia, in depression we have a similar level of cognitive impairment, especially in depressive patients compared to the control group in terms of data information rate, in terms of mental flexibility and working functions, exhibit lower performance compared to the normals. Especially previous depressive episodes and the psychotic characteristics exhibit a positive relationship with cognitive impairment. So far, the effect of antidepressants on cognitive functions, the cognitive functions have usually been omitted, overlooked. As you know, cognitive symptoms has been identified in more than 30% in patients who respond to antidepressant treatment. And these symptoms may be the results of the side effects of the antidepressants. The effect of antidepressants on cognitive functions is more prominent in elderly population. Most of the studies have been conducted on elderly. The effect on cognitive function is more pronounced on young patients. As you know, in major depression, in all elderly patients with major depression, cognitive impairment is very pronounced. In a study conducted on depressive elderly patients, double-blinded paroxetine or nortriptyline was administered. The working memory, data processing rate, episodic memory, and attention was measured in the patients on the controls. The association of space and time This is how the working memory is defined. Even if the depressive mood is improves using antidepressant in elderly depressive patients, the cognitive impairment may still continue. This is the outcome of the study. In another study, 72 ambulatory patients with a mild to moderate cognitive deficit were treated with cholinesterase inhibitor, and the outcome was evaluated for a period of 9 months retrospectively. And the suggestion is that patients who are on regular antidepressant treatment, Alzheimer's patients, the cognitive deficit may be improved. In another study, the cognitive function in patients with heart failure, comorbidities, major depression were improved. And in heart failure patient with major depression, a significant degree of cognitive improvement has been identified. In another study, with a duration of 12 weeks, the sample size is quite high. Sertraline, fluoxetine, and nortriptyline were evaluated in terms of their effects on cognitive functions. Improved depression and reduced side effects in reduced anticholinergic side effects have been associated with a better cognitive performance, and the correlation between the improvement in depression and cognitive performance has been shown to be best in the sertraline group. As a result, the acute improvement in depression is also associated with an improvement in cognitive function. Together with the improvement in the disease, also the cognitive performance is observed. Especially long-term benzodiazepine used and its effects on cognitive functions was evaluated. The most common side effects include increased sedation, attention deficit, and anterograde amnesia. And these issues were reviewed, and benzodiazepines have been shown to result in attention deficit, objective and subjective sedation. However, they do not result in significant memory deficits. Another significant public health problem, long-term benzodiazepines, whether it causes a cognitive deficit in the individuals. This was the question, and a review study was conducted to bring an answer to this question. 6 prospective studies were reviewed, and 3 of them, a significant risk was identified in terms of cognitive performance, significant performance impairment. In the other 2, no significant association could be identified. In order to look at the the effect of chronic benzodiazepine use in the elderly population, and with a duration of 9 years, different tests to measure the cognitive performance were performed, and as a result, long-term benzodiazepine use has been shown to have a slightly negative effect in the elderly population on cognitive performance. There are some studies on the use of lithium and its effects on cognitive function. As you know, recently evidence has been brought up on the neuroprotective and neurotrophic role of lithium. Lithium has been shown to have a protective effect on the various stressors that are the result of stress, trauma, neurodegenerative diseases, or psychiatric disorders. However, its effects on cognitive function is not clear. We couldn't come up with a definite answer. There are some comparison studies on lithium and mood stabilizers. We also know that lithium per se may lead to cognitive functions, and lithium valproic acids have been associated with cognitive impairment. Shenturk and his co-workers have conducted a study on euthymic bipolar patients. 7 patients received lithium monotherapy, and 11 received valproate monotherapy, and 29 healthy individuals were used for as a control group. In both of the groups, compared to the healthy individuals, the instant verbal memory was insufficiency. This may, of course, be the result of the disease itself, or may be induced by the mood stabilizers, which is the valproic acid in this case. Another study there was a switch from lithium to valproic acids, and the cognitive functions have been shown to be better after the switch. Valproate, although it has a good safety profile, cognitive functions is rarely reported. In a study that was conducted in 10 patients with reversible Parkinsonian symptoms, in 6 of them, cognitive deficit was identified. After the discontinuation of valproate, the symptoms improved. There is an increasing number of studies on lamotrigine in the recent years. This is a study conducted by Kay and his co-workers. Patients with a bipolar affective disease, 1175 of which are on lamotrigine monotherapy or combined valproic acid, lithium, and antipsychotics. For 12 weeks, patients received 200 mg per day lamotrigine for 12 weeks, and it was shown that they have a better cognitive function, whether another drug is added or not. In lamotrigine monotherapy has also been shown to have a safer neurocognitive profile compared to other mood stabilizers. And finally, there are some studies. A study that was conducted in Turkey on methylphenidate in patients with attention deficit and hyperactivity disorder, where the attention, visual memory, and the visual perception and organizational skills were impaired in these children. Various neurocognitive tests were performed, and a significant improvement has been shown for the Bender-Gestalt visual motor perception test. This is my final slide. The methylphenidate treatment has been shown to show an improvement in the tests that indicate motor coordination and response delay power. In conclusion, I would say that in the literature, antipsychotics on psychotic patient groups on the neurocognitive performance was investigated most of the time, and new generation antipsychotics have been shown to improve the cognitive functions better than the typical classical antipsychotics. Long-term benzodiazepine use leads to cognitive deficits, may lead to cognitive deficits. Moreover, mood stabilizers, especially lamotrigine, is in the focus, but it's a question mark whether it's as effective as lamotrigine as well as other agents. Thank you very much.